And it's now my pleasure to ask Ian McInnes, where are you, Ian? The head of College of Medical, Veterinary and Life Sciences here at the university, to chair this session.
Well done. Most people take months to train in that title, but you pronounced it perfectly first time round. Great to see you all. Thank you for coming along. Normally I'm looking at about 800 first-year students, so it's wonderful to see all these wise, mature minds looking back at me, and I'm absolutely certain that we're going to get a ton of questions. We want to move now to the life sciences. Life sciences is such a rich potential for Scotland. We outperform our peers in other parts of UK and Europe per FTE in terms of what we find, what we publish, and then this is all about what we do with that. There are few people in the world better equipped to help us, to encourage us and to drive us than the two speakers we have in this next session. Real pleasure, Kate Bingham, to introduce you. Kate, I think needs a little introduction. Over to you. Go for it.
Got the clicker, and I am going to bring everybody back on time again. So I'm going to be super quick. Now, so I've started off with a graffiti chart. This actually matters because in our office in London, we're very cool, Britannia. Every drug that we have invested in at the beginning, which actually makes it, when if you think about it, 90% of drugs that go into clinical trials will fail. Anytime any drug actually gets registered and gets approved, gets spray painted on our wall. So that's why I always like to think of what is it we do, and we're here to develop new drugs to treat patients that are not treated with current medicines. So just as a quick background, what I develop and do is to invest in breaking biology and science to develop new drugs for unmet patient diseases. This is all the different drugs, 27 actually we're now on, drugs that we've funded right at the beginning of the discovery period, early clinical development. I think in no case have we been responsible for the launch of the drug, because we're at the early stage. And the bit that really matters on this chart, which you probably can't see, there are 6 little green boxes where we've invested in the first class of drugs, so a completely new way of treating disease. And that is coming out of innovation and institutions like these that are coming up with new ways of understanding biology and what are the disease drivers across different patient populations. And that is what we do, but of course I'm an investor. So my job is actually to stay in business and to generate returns for the investors, which are pension funds, or charities, sovereign wealth, family offices. And what I have to do is to make sure that I can return proceeds back to our investors, which are highly risky investments because our funds are closed-end funds, and we've got to be able to do that repeatedly, because once you've invested, you're in. So you can't then get out. We're an illiquid, high-risk investment. So we've done a good job over the last 20-something years, 20% net per year. So it's good for pension funds, and that's why we need to try and loosen up some of the capital that we have in this country to invest in funds, not just ours, but other across the sector, where we can generate the returns. I've got less than 1% UK pension funds as investors, just to give you a flavour. So obviously the reason I'm sitting here is because everyone thinks of me as vaccines, and clearly the vaccine vaccine task force went incredibly well. You can see the 2 photos that I think everybody has seen very widely. The left hand was the first dose of the Pfizer-BioNTech vaccine, and the right hand was the first dose of the AstraZeneca vaccine. AstraZeneca Oxford. This is my favorite chart. I don't know if other people use the world in data, but this was in early December 2020 when they were mapping the entire world of who was actually vaccinating their populations with COVID-19 vaccines, and we were the only one. So that is, if I have an epitaph, that is my epitaph. But importantly, the most likely outcome of the vaccine task force was actually going to be failure. Because if you think about all the things that were counting against us, we'd failed to develop vaccines for SARS and MERS over the last 10 years. We had the leading vaccine candidates, the mRNA and adeno, had never been approved for any product ever. And the quickest vaccine that had ever been developed before took 5 years, and that was 50 years ago when regulatory standards were much lower, so that was months. So the likelihood was this was going to fail. But the reason it didn't fail was, I think, in part, I think it was a bit serendipitous, but the reason was in part because they chose a venture capitalist to actually lead it. Because especially when you're in my business, things fail. Almost everything goes wrong, and because I've been in the business now a long time, I have seen science fail. I've been sued on IP. I've seen businesses blow up. I've seen clinical trials fail. I've run out of money. I've hired the wrong people. All of these things that either you are likely to expect or that you should make sure you don't make that mistake twice, I've seen. And that is incredibly helpful because it brings a very, very focused mindset, thinking about how do you address both my day job in terms of investing in drugs, but also in thinking about how do we select and accelerate the development of vaccines during the pandemic. So I've got my 4 key lessons. The starting point, which we've heard a little bit about this morning, which is protecting universities and the astonishing leadership we have in academia. We were given an incredibly, relatively strong start because we'd had very serious and incredibly thoughtful leadership in vaccine development already. And precisely because we had the SARS and MERS pandemics, actually the academics had a long time to start thinking about, well, what would be a vaccine that would be effective against another coronavirus? And without that, I think we may well all be, still being sheltered at home. But because there was that insight, we were able to kickstart and leverage that learning from the previous pandemics and get the vaccines designed and developed much, much, much more quickly. The second aspect, which is absolutely not something that government is really very comfortable with, is the whole management of risk. So when Boris called me on that very fateful day in early May 2020, he was doing all the sort of, I want you to sort it all out. And my main message back to Boris was to say, you have to recognize that the most likely outcome here is failure, but you should be doing it. And what you're going to have to do is you're going to have to put cash up ahead of knowing whether or not these are going to work, to both scale up the manufacturing, but also to get ahead and to run the clinical trials on these vaccines before you know whether or not any will work. And that idea of putting money, the public money, into a program where you can be sure you will be losing money is not something that government is comfortable with. Yet, actually, they took a deep breath and said, yes, we'll do that. So that, I would say, was a ballsy thing by government. I was, of course, nothing to do with actually spending any money. The ministers took the decisions on spending money, and the civil service made sure that the way we were doing it was kosher. So we were actually just hired guns. We were external advisors recommending how they should spend the money. So that, I would say, was something that was really important, as to thinking about how do you manage the risk? And we did it exactly the same way as we do in venture. So you work out where you want to get to, and then you split it up into small bite-sized chunks and say, right, we'll give you money to do this first section. So in the case of vaccines, it was the initial scale-up of manufacturing and the initial clinical trials. And once you've shown that you can do that, then we'll release the second money. The third on my slide here is the people. And again, the reason why the vaccine task force was required was because we didn't have the people in government, either in civil service or in the politicians. And more importantly, we didn't have the relationships with industry to actually kickstart those discussions. And actually, that is a massive fail, because while you obviously can't legislate for who wants to put themselves up to be a politician, we should, as a government nation, require our government machinery to have the skills and the relationship, and we don't. And I've gone on the record, we have 90% of the civil servants have humanities degrees, only 10% are STEM, and that is the wrong way round. We've got to have our administrators understanding what it is that to deal with these complex science projects. Now, in the case of the task force, I was able to recruit my own team, and we brought in a kick-ass team, and outside Russia, I would say, because we didn't explore Russia at all, we either knew the companies involved, or we were one step away and we knew somebody who did know them. So we were able to cover the globe very quickly, and it's exactly the same in venture investing, which is you need to make sure you bring the best people in ever who've done it before and know the potential pitfalls, but also bring the relationships, because we pulled a lot of favors, as you might imagine, during the pandemic. But of course, as I build my companies, I pull a lot of favors there too, because I want anybody who can help make my company succeed, I want them to do that. And then the last thing, I mean, it's obviously very clear, set the objectives and make sure that you've got aligned incentives to ensure that everybody is actually all pulling at the same place, and that you've got very quick and speedy decision making. So that was one thing that was very unusual in government, is we didn't have a sequential set of decisions. We had a single investment committee, because that's what I'm used to in venture capital, an investment committee which had the ministers from business, health, treasury and cabinet office, and they had to meet all together and they had to give an answer. And they recommended what we did, which was fantastic, but it absolutely supercharged what we did in government. And just to give an example of the sort of VC mindset, and you can see we're all a bit ADHD, we're always in a hurry, we always want to get stuff done. And so in the case of vaccines, we are not a big market. You know, we were looking at this and thinking, well, poxy little UK, how are we going to compete against the Americans, the Europeans, the Japanese, who have much bigger buying power than we do? And so the idea was, okay, we've got to leverage what we've got. And what we've got is fantastic manufacturing. So we can't start stuff from scratch. Let's scale that up. We've got fantastic national healthcare system. So let's use the ability to run clinical trials nationally to actually accelerate clinical development. And let's just put the A-team on it to make sure that every single vaccine company we work with has access to the people that can help accelerate in the UK. And that really worked. I mean, I'll just give you an example. We've not yet built a company in Scotland. So that is a goal that we need to pay attention to. But we have just built a company in Cardiff. So while, of course, the bulk of what we've historically done has been in the Golden Triangle, we will go wherever the best science is. And this one is in precision psychiatry. So it is an area of massive, massive underinvestment and huge clinical need. So we're specifically looking at the severe psychiatric diseases, especially those affecting the young: psychosis, treatment-resistant depression, schizophrenia. And what happens is you get imbalances in excitatory and inhibitory pathways. And this particular company that we've set up came actually with industry scientists, but embedded in Cardiff. So they were developing drugs that had the quality of industry, but the breadth of academia. And it's worked out very well. We seeded it, we started bringing the team together, we had a formal seed funding where we brought one other investor in, and I've put it in grey, but we are just about to announce, because it's now signed, a fundraising of north of $100 million to take the lead programs into clinical phase 2 studies. So it's highly unusual to be raising that sort of money, but it just shows we can develop some incredibly clever, brilliant companies based on UK science. And there will be just as much up here as there is in Cardiff. And it's just a matter of making sure that we have the network and the relationships so that we can actually pull those two together, because there is no shortage of capability of VCs to want to do it. We've just got to make sure that we know about that, that great science where it is. And then what I just thought I would do, just as a taster, in terms of what could Scotland do, especially in a time of sort of geopolitical crisis like this. and these are my sort of, I'm taking academia as read, that we compete very well on the global stage. But the one thing the UK does particularly well and vastly better than any country anywhere is these big data sets. So whether it's Our Future Health, Biobank, Genomics England, and again in Scotland with Andrew Morris, you have had an HDR UK, you've got a huge ability to basically interrogate these large data sets, patient data sets, to get both longitudinal data and very deep data to both come up with new biological mechanisms that could be driving cancer, new ways to identify patients early, so you don't wait for patients to have heart attacks, you identify who's at risk and you intervene early. And from a cost and healthcare perspective, that has got to be the way we're going to have to go. We can't continue to basically bankrupt these healthcare systems by just treating patients too late. So we've got to get in early. The UK is a global leader in this, by far. I mean, it's the biggest, the deepest, and the longest. And we really need to take advantage of that. On the right-hand side, on advanced biomedical manufacturing, again, we have a phenomenal industry here, and especially in this part of the world. So, and I would include the Northeast, Darlington and the Tees Valley, up here through to Glasgow. We funded Valneva during the vaccine task force, but you've got Medicines Manufacturing Institute here, you've got oligonucleotide. There is going to be a huge, big opportunity that's going to get announced, I would hope in the next 2 or 3 months, about continuous flow RNA manufacturing. So if you think about RNA encoded proteins and the challenges we've had manufacturing those, and they're expensive and difficult and require a ton of investment, actually this is going to be a transformational game changer. So this is something to watch the space, but again, we're really good at it. The MHRA is our regulator. As I'm sure you've all read, in the US, Trump has chopped the top 25% of the FDA, and the FDA is going to be severely, severely hampered for really a long time. The MHRA is a globally recognized regulator. We have a new leadership who's just come in with a very, very clear mission to modernize, digitize, and accelerate what the MHRA does. And then, of course, we've got our national ability to run clinical trials, which isn't good enough right now. It is a fail right now compared with what we could be. But the fact is, if you put all that together, and then you've got the underlying basis of academia, we are in a globally fantastic position to really build some real kick-ass companies. So if anybody is thinking about what is my message is huge optimism and opportunity. We've got to make sure that we're joined up in using and leveraging the resources we've got, but we can become, I think, a game changer. Europe is slow. Europe regulation has just extended their time, so they are just sleepy. They're sleepy at the wheel. If we get our acts together, we could do a really good job. And I'm on 16 minutes, I'm sorry. Okay, I'm stopping.
Absolutely brilliant, Kate. A spectacular combination of energy and inspiration. So we're going to forgive you that minute, Kate, and some. Thanks so much. Now we're going to just keep moving, and then we'll take Q&A for both of our speakers at the same time, if that's okay. It's a real honor to introduce to you Kazim Kutay, who is the CEO of Novo Holdings, which, if I've got it right, is the foundational investment part of the Novo Foundation. And all of you know about Novo Nordisk because they are one of 2 companies who are absolutely pioneering the management of obesity through pharmaceutical means. So I think this is a young man that knows a lot about what we're talking about. So Kazim, welcome. Looking forward to hearing what you have to say.
Thank you. Thanks a lot. Thank you. Yeah, thank you. Great. Well, it's a pleasure to be here. My first time in Glasgow, so I'm really delighted that I'm here today. I've very often flown into Glasgow Airport, but it's always to then head out to the beautiful countryside around here to play golf or fish or do something like that. So to be in the heart of the city, in this wonderful campus with this group is a true pleasure. And I want to also extend a big thank you to Gordon Brown for inviting me to participate in today's conference. And Gordon, I have to say that your tireless efforts in support of innovation, growth, and very importantly, economic inclusion are a true inspiration. So thank you for everything that you do. So I'm Qasim Kutai. I'm the CEO of Nova Holdings. I'll say a few words about that just to put things in context before sharing a few thoughts with you about how we make the most of the great innovation that does reside in Scotland and in the UK more broadly. I'm a UK national. I grew up in London, but left London 9 years ago to take up the post of CEO of Nova Holdings. So I am now based in Copenhagen, which is a lovely city. But I do make it back to the UK very frequently. And Nova Holdings, just to give you a sense, and Nova Holdings is in the middle of the picture here, is a holding and investment company that manages all the wealth and assets of the Novo Nordisk Foundation, which has assets of about 140 billion, which makes it one of the top 3 foundations in the world, along with Gates and with Wellcome. And last year, our foundation gave out 1.4 billion euros, most of which went to medical research. So what does Nova Holdings do? Nova Holdings is the controlling shareholder of Novo Nordisk, which is Europe's largest pharmaceutical company. For a long time, the world leader in insulin and diabetes, and more recently, of course, with Ozempic and Wegovy in obesity. Novo Nordisk, which is a very exciting area that people don't talk about, which is bioindustrials, which is biotech solutions for industry. And then about 180 other companies that we invest in through our venture team, through our growth equity team, and through what we call our private equity buyout team. And together, if you add all that up, we are probably the largest and most active investor in healthcare, in life sciences on a global basis, with offices in Asia, Europe, and the US. And this is the ecosystem that we have. On the left, you've got education, research, innovation, etc. That's all carried out by our foundation. And then everything that's investment related, seeds, venture, growth, principal, and then, of course, the 2 operating companies. That is all through our investment. And somebody earlier on here, I think it was Dan, mentioned the company Exscientia. We were one of the largest and earliest backers of the Scottish company Exscientia, which is AI-enabled drug discovery. You can see it. It's the second from the top under our growth investments pillar. So, just a few words about Europe, the UK, and Scotland. And I'll be making some comparisons and some observations about Denmark, with one big caveat. Please. Comparing a country of 5.5 million people to a country with close to 70 people is not a fair comparison. But nevertheless, I do think there are some lessons learned. I think, as we heard this morning many times, Europe and Scotland and the UK more broadly needs to become stronger at scaling and translating basic science. The innovation is here. That's not the issue. The issue is translating it. Scotland is already doing a pretty good job at that, and the UK, as Kate said, but then the scaling becomes an issue. And you can see that even though we innovate and translate, even though we innovate, the translation, so it's not just scaling, there is a translation issue. So if you look at the chart here, and look at the amount of VC funding that's taking place in Europe versus the US, whether it's at the seed stage, early stage, and later stage, it's a huge gap. And it's not justified because the innovation that's taking place in Europe is on par with the US. There are as many research publications coming out every year in Europe as there are in the US. So our ability to translate that into companies and to scale those companies to a commercialization onto a commercialization path is the big issue for Europe. And that leads me to this notion that's been talked about today, which is an industrial policy strategy. I like to think about it in terms that I will get to in a second, but just to make the comparison with Denmark. Drivers of strong biotech ecosystem in Denmark. An ecosystem is a word that I like to use frequently, because if you are talking about innovation and scaling, you have to ask, what are the pillars of that ecosystem? What do you need to deliver on that promise? And let me tell you some of the things that they have in Denmark, and then we'll get to Scotland and the UK. One thing that Denmark has, which is very difficult to replicate, is this concept of the foundation ownership. So what I just showed you earlier, with a foundation at the top that controls Novo Holdings 100%, and then we, in turn, Novo Holdings, control these operating companies, that is a very common structure in Denmark. So Novo Nordisk, by far the largest company in Denmark, is foundation controlled. Maersk, the largest shipping company in the world, also based in Denmark, foundation owned. Carlsberg, the third largest brewer in the world, foundation controlled, a very common structure. So what does that mean? It means protection. It was the point that the lady made earlier. Those companies didn't leave Denmark. They stayed, and that is a key pillar of any ecosystem or cluster that David was talking about earlier. If you wind the clock back 30 years ago, it wasn't Denmark that was the life science or biotech hub of Scandinavia. It was Sweden. But they lost Astra to Zeneca. Today it's called AstraZeneca. They lost Pharmacia to Pfizer, both of which got acquired. And a key pillar of the cluster disappeared because those companies had provided so many of the management teams for the startups. There was several spin-offs that came out of those teams, those companies historically in Sweden. Denmark, on the other hand, because of the foundation ownership, Novo Nordisk stayed. Novo Nordisk would have been acquired many years ago if it was an independent company. So one lesson for the UK, and I've made this very clear, it's not very fashionable because it sounds protectionist and it's perhaps not very Anglo-Saxon, but if GSK and AstraZeneca were to leave this country, that would be a big blow to your ecosystem. So if you think about clusters, you think about the Golden Triangle, you've got to think about, and I think Rachel Reeves refers to it in part as secure economics. Again, not fashionable to be protectionist, but there are certain critical industries where you need to think about protecting your interests. And life sciences, particularly for the UK, is critical. This country will not achieve its growth ambitions without life sciences. As a reminder, the sector is the second largest industry in the UK after financial services. The other benefit, of course, we have in Denmark is the long-term perspective. So when you have a long-term owner, a foundation, you're able to make long-term bets, not worry about activists coming into your share price and saying, give us all the cash and give us all the cash on your balance sheet as dividends, etc. But of course, we also have a public share price, and it creates a really nice positive tension between short-term and long-term. And then there's one thing that the country is blessed with, which of course is very difficult to replicate, which is investment recycling. Because the foundations take a big chunk of the dividends from these companies, whether it's Carlsberg or Novo Nordisk or Maersk, because they own them or they control them, but then they put it back into society. And they fund further research, et cetera, et cetera. One thing that we do in Denmark quite a bit, and certainly we as Novo Holdings do a lot of, and this is something perhaps that the UK and Scotland can learn from, is what I call quid pro quo investing. So a lot of funds come to us, like Kate's fund, and say, please invest. And we'll say, yeah, we've got a lot of money, so we'll not only invest, we're going to give you a big check. but we will sit on your advisory board, and we want to make sure that you will review X number of Danish opportunities a year. Sometimes we even go further. We've just asked a fund to set up a presence and an office in Denmark. And I think that's one thing that the UK perhaps can do better. Perhaps some of your pension funds can think about. If they're going to write a big check to a growth equity fund, tell them, yeah. Particularly now, actually, it's a very tough fundraising environment. You want 50, we'll give you 100, but this is what we want you to do in Scotland. This is what we want you to do for our cluster, as David was referring to earlier. STEM talent, Denmark is full of it, so that's not an issue. And then collaboration between universities, hospitals, and industry, and that's where the UK is really falling behind, I'm afraid, and I'm going to get to that in a second. So what has Denmark achieved? I'll go through this very quickly because how am I doing on time? Am I already 5 minutes? Perfect. But basically, this is Massachusetts, of course, Boston, the leading cluster for life sciences. You can see in the top chart. And that is basically the number of publications that lead to startups. And as I said, publications in Europe are on par with the US. Pre-BII, BII is the Bioinnovation Institute. It's an incubator that was spun out of our foundation with the mission to incubate. So this is even before any venture funding. This is for the professor, for the researcher that has a brilliant idea but is at a loss. Who do I talk to? Where do I work out of? Who guides my business plan? They come to this incubator and we provide them incredible support. And post setting up this incubator in 2017, if you look at what's happened now, Denmark has overtaken Massachusetts as a translation hub. The translation gap has been totally closed. So we really need to think about what incubation means. I think if you're going to have a cluster for life sciences in Scotland, in Glasgow or Edinburgh or whatever it may be, you really need to make sure that you have an incubator in this country with the right mission and capitalized in the right way. Let me say a few words in conclusion about what I think the UK can do. And that is really to build a holistic life science industrial policy strategy. And let me tell you why I think it's holistic. I read Dan's innovation report, which he went through this morning, which I thought was excellent, Dan. I would stress one thing. I think the one thing where we do need to do a little more thinking, and perhaps where the report didn't focus enough on, but you can't focus on everything, is, to me, it sounded very government-led. You know, the government should do this. For me, an industrial policy is not about government. Industrial policy strategy means building consensus around 3 or 4 key priorities, having a clear view about who's going to be involved around the table for that consensus, and then executing together. And if we're talking about life sciences, there is no industrial policy strategy if it's just government. It's government, it's industry, it's academia, and it's the NHS. And unless those 4 are joined up and agree on what the key challenges are and agree on what the solutions are, you don't have an industrial policy strategy. And the way I like to think about it is long-term. I think you need to have an 8 to 10-year strategy. And I think you need to do things, as Kate talked about, in bite-sized missions. I think a lot of these strategies fail because people are overwhelmed. It's ridiculous when I see strategies with sort of a task list of 10 things to do. No. You take a couple of items every 2 to 3 years, you execute on that really well, and you move on. So what would be an example be? So for example, government. What would government be? What can government do? First, regulation. Many of us don't like Brexit. I don't like Brexit. It's a reality. Let's make the most of it. The most obvious area to make the most of it is regulation. There is regulation in Europe that we can easily live without, and frankly, Europe can live without. Bad news out of the EU yesterday. They have shortened the exclusivity period for certain drugs. I hope the UK does not follow suit. And if the UK doesn't follow suit, it can go to industry and say, by the way, we're going to develop an industrial policy strategy together. Europe has cut your exclusivity period, your patent period, by 2 years. We will stick to the original timeline, but this is what we want from you. Speed up approvals. I'm worried about the MHRA, Kate, and I'll tell you why I'm worried. Because whenever you have a small regulator next to a big one, the small one gets crowded out, because the small one always has a tendency to want to wait to see what the big one does first. But we'll pick that up, and I know I hope it's going to change, because the leadership has changed, but that is another critical one, because you need to go to industry with two or three chips and say, I'm going to give you this, and this is what you're going to do for me. I can go on and mention a lot of examples, but government can do a lot. Industry can, 2 minutes? Yeah. Okay. Sorry.
2 Glaswegian quick minutes.
Okay. Industry can do a lot, and industry will step up if there is a bargain. I'll give you a great example. We lobbied industry very hard, along with a couple of other institutions, to set up something called the Action Fund, which is an antimicrobial resistant fund for $1 billion. It came on the back of a fund we set up called Repair in 2018 to tackle antimicrobial resistance. It was a $100 million fund. That wasn't enough. We went to industry and we said, you failed. Because there's no money in antimicrobial resistance, you didn't invest in it, and now we've got the silent pandemic in the world. We raised $1 billion. GSK put 100 million. Novartis put 100 million. There is a corporate social responsibility that industry does have, and you need to play on it. What does that mean? Get industry to allocate part of their venture funding, not for their own strategic interests, but for the growth scaling that we've been talking about. Why not go to GSK and say, you've got a 200 million fund, can you please have another one next to it that scales, but not for your strategic reasons, for the cluster, for the ecosystem, because eventually you will benefit from that ecosystem as well. And they will benefit, because that's the lesson of Denmark. Denmark is so focused on ecosystem because with a long-term view, everybody at the end benefits. There's a few other things, but I'll stop there because I realize that I've gone way ahead of time. But suffice to say, I think there's a lot more that we can do, and given that the underlying innovation is here, there is no reason for us not to succeed.
Thank you, Kazim. We could have listened to Kate and Kazim for quite a considerable length of time. We would have learned exponentially. We have a few minutes for questions. Those of you who understand GLP-1 agonism will know that you're going to start to feel hungry quite soon. So just while people are thinking, we have some roving microphones, at least I hope we do. There's one man with a roving microphone, which is another one, great. Now, we have a question there. Now, while this young man is running to the questioner, let me just, Kate, so to misquote Dickens, it was the best of times, the worst of times, the pandemic. But it surely brought us the urgency that we needed to go from biological idea to intervention. Now, vaccines weren't a new idea, but the modalities of vaccination turned out to be pretty interesting, particularly in the RNA field. So just how do we bring that sense of urgency into 2026 in Scotland?
So some of it was regulation. Yeah. So basically removing the slow bureaucratic red tape that gets in the way. And this is where I have a slightly different view on the MHRA, which was the first to approve mRNA, adeno, bivalent, lateral flow, the two antivirals. I mean, they did everything before everybody else. So they weren't crowded out, and I think they can do a lot better. They need to be funded, but they could do a lot better. So actually getting rid of regulation makes a huge difference because people want to get on with it. They don't want to be bogged down with having to fill out forms and follow whatever bureaucratic procedures there are. Clearly, you can't put things into people without
I was
following
going to say,
the
as a
law.
clinician, I think what we heard you saying there was appropriate regulation is essential, but not the additional baggage that goes with that.
It's just too long.
Just to be clear.
Just to give you a flavour, if we want to start a clinical trial, we can get a clinical trial up and running in a matter of weeks in Spain. In the UK, if you get it up and running within a year, you're doing well. And that just simply doesn't work. So that means that even though I have UK companies, I can't get UK trials up and running to be quick. And it misses the point. We should be able to do it. We know we can do it. When they cleared the decks with vaccines, we were able to do it really quickly.
And that's the key lesson from the pandemic. We can do it. We just choose for some reason not to do it. And you have the experts as the chief investigator of global trials. It is so depressing to be the chief investigator based in UK with first patients in pretty much anywhere else. So we have a question in the room. So please do, sir.
Thank you very much. My name is Stephen Shield. I'm from the Net Zero Technology Centre based in Aberdeen. So we're all about innovation in the industry, the application of innovation, working with...
Do you mind speaking up just a bit?
Yeah. Can you hear me now?
Yeah, that's
Thank you.
Okay, I'll be very quick. I'm not going to make a speech, I promise. So we're all about application, taking innovation, industry innovation, testing, demonstrating in real life environments. So I have two things I'd like to put on the table. First of all, it's a thank you to Kasim and Nova Holdings for all the work that your company and companies like you have done for type 1 diabetes. I don't know if you hear it often enough, people who are affected by that disease actually saying thank you, but absolutely fantastic. Thank you very much. The question I have is for both of you. I'm not buying that the universities are absolutely plugged into all the innovation needs that our industries have. How can we make access to industry requirements and needs really live and relevant within the university sector? And if you could speak beyond life sciences, just observations, that would be super, because it's very easy to work with big companies, but there are innovation priorities out there that I don't think are being addressed.
Great question. Thank you. Kazim, can you take that first?
Yeah, just make sure I understood the question. You're saying that you don't think that a lot of innovation that should be worked on at the universities is being worked on. Is that right? Well, look, I think first of all, when you're dealing with the sort of issues that we talked about, which are significant, how do we make sure that life sciences remains a vital contributor to the UK, without which the UK will not achieve its growth ambitions? Simple as that, right? I think you touch upon then a lot of the issues that I talked about, and there's a lot of other priorities. I think the innovation one is important, and of course we can always do more, and of course we can be best coordinated, but for me, I just think that is the least of the concerns. My biggest concerns are translating whatever innovation takes place into startups, getting the scale-up capital that eventually makes sure that those startups thrive, and most importantly, get their products to patients to treat unmet medical needs. And I don't want to repeat everything else I said. So I take your point, but it's the last thing I sort of worry about when I think of the mountain of challenges. And I'm a big believer in not tackling challenges all at once, as I said earlier. That's why I do think an industrial policy strategy has to have an 8-year cycle as a minimum, and has to have clear timelines about how you're going to divide things up and what you're going to do first, and how you're gradually going to build the pyramid.
So if I had a magic wand, I would make every single person that goes to university spend a year in industry. And I would bring industry into universities. And so I would have industrially funded, dedicated to that, whatever company it is, within the university, so that you get that porosity of academia working with industry and industry working with academia. And when you're at the lunch queue and you're getting your Coke, you don't know where you've come from, and you sit down at the table, and it might be a mechanical engineer talking to a nanotechnology, talking to an AI expert, talking to someone who's looking at, insects. that is what's going to really generate the stimulation of ideas and allow students to start thinking about, well, I'm interested in this area, and how do I do that? Oh, well, there are companies there. I can go and spend time during my student education to actually learn about that. And that, I think, when you get into the practicalities of what's the purpose of learning if you're not ultimately trying to make something. Mostly you're not writing textbooks. You're actually trying to produce products that are going to help people. And you can't do that in an ivory tower. You've got to do that with practical experience, and that's how industry...
We're about to be thrown off the podium. I know, Kazim, you wanted to make one quick final comment. My apologies, sir, that we can't take the question.
Brilliant point by Kate, and I couldn't agree with you more. And just to mention that does exist in Denmark. So you cannot graduate with a master's degree in Denmark unless, while you're studying for your master's, you spend 3 days a week for X number of hours working in industry. Nice. And we have about 7 or 8 of those. We call them student analysts. And so absolutely spot on. Mandatory. There we go.
And that's how the quadruple helix can be made to work. Ladies and gentlemen, I'm so sorry we are cutting this down, but I'm sure you want to join me in thanking fantastic talks.